DESE guidance mandates that at the start of the school year through October 1st, all students, educators, staff, and visitors, regardless of vaccination status, must wear masks while indoors and while riding buses. The purpose of this policy is to encourage higher vaccination rates among students and staff, and to implement a uniform policy for all schools to begin the year. This measure will allow school to fully reopen safely. After October 1st, the policy allows for middle and high schools with vaccination rates of at least 80% to lift this mandate. Unvaccinated students and staff would still be required to wear masks. DESE will revisit the mandate as warranted by public health data. Exceptions are students who cannot wear masks due to medical conditions or behavioral needs, any person eating indoors, and when outdoors, masks are optional. Districts using approved diagnostic tests or the statewide testing program can implement a new test and stay protocol. Under test and stay, asymptomatic close contacts of individuals with confirmed COVID-19 can remain in school, and they do not have to quarantine if they receive an individual rapid antigen test each school day and test negative, are asymptomatic, wear masks in school at all times other than when eating or drinking. When eating and drinking, they should maintain 3 feet of distance from other individuals to the extent feasible. The following close contacts are exempt from testing and quarantine response protocol if they remain at least 3 feet apart and masked while in classrooms, wear masks and keep the window open on buses, if they had COVID-19 within the past 90 days, or are fully vaccinated and asymptomatic. The duration of the test and stay program is 7 days from the date of exposure. If the 7 days include weekends or holidays, individuals should quarantine during those days. If they remain asymptomatic and are tested immediately upon returning to school and test negative, they can stay in school. Individuals should conduct active monitoring for symptoms throughout day 14 and self-isolate at home if symptoms develop. Self-isolation for COVID-19 positive cases is a minimum of 10 days after symptom onset or after a positive test. They can return to school after 10 days once they have been without a fever for 24 hours without taking fever-reducing medications, and they experienced an improvement in all other symptoms. DESE and DPH continue to strongly recommend that all faculty, staff, and eligible students receive the COVID-19 vaccine. There are more than 900 local vaccination sites available across the state, and most accept walk-in appointments, including CVS and Walgreens pharmacies, pediatric primary care offices, and community health centers. As a reminder, the COVID vaccine is free for all, and no ID or insurance is needed to obtain the vaccine. Visit www.mass.gov/COVID vaccine for more information. Districts and schools are encouraged to maintain or establish diagnostic and pooled testing for students and staff. Districts are strongly encouraged to sign up for the statewide COVID-19 testing program. Diagnostic testing, such as the Binax Now rapid antigen test, is an important tool as we head into cold and flu season, and for use in testing asymptomatic close contacts. DESE and DPH will continue to offer these services at no cost to districts. These no-cost services include optional support for districts that want additional staff to conduct testing on-site and/or help with testing logistics and communication. Additional information: DESE and DPH urge all schools, and in particular those with vaccination rates below the Massachusetts state average, to host an on-site vaccination clinic during summer orientation events or when classes begin. A DPH-approved mobile vaccination provider, including clinic staff and vaccination administrators, will be provided free of charge. Interested schools can submit their request via an online form located on the mass.gov website. By working together, we can make our school a safe place to learn and work.